over, and I'm going to be providing my patient today with a bed bath. First thing I would do is my 7 steps. Check the physician's orders. Wash hands. Gather my equipment down here. At the bottom of the bed, it's already gathered. And then I would go into the patient's room and check to make sure it's the correct patient and establish that what my name is. My name is Amanda. I'm going to be giving you a bed bath today. And then I would establish privacy by drawing the curtain. The first thing I would do is ask the patient if he would like to go ahead and use the bedpan. He doesn't, so I would go ahead and place the bedpan into the drawer. And then I would bring the bed up to working height.
I mean, I don't know anything.
Just waist level. Okay, and then I would come down here after washing my hands. My gloves on. And I have my water basin here filled up with 2/3 with water, no soap yet, because we're going to do the face.
I know that's another place.
So what I'm going to do is go ahead and put the blanket, bed bath blanket over the patient. And then after doing this, I'm just going to remove the sheet from underneath the patient.
I'm going to do the one because
I'll do this procedure. And dispose of those soiled linens after. So I would take this towel, place it underneath the patient's face because that's where we're going to start first. Here I would start the procedure. So I fold up my washcloth here like a mitt, as I was taught. And then I would go ahead and dab it into the water here. And each time I would wash around the face, making sure not to use the same part of the washcloth twice. I would do the cheeks, around the eyes, the forehead, around this way. Okay. And then I would take this off. And I would use the towel here to pat the patient's face dry. And I would get new linens each time I would do a certain area. So now we're going to take this gown off, and we're going to start with the bottom. And as I'm touching the patient, I'm grabbing the patient only at the joints, so it's comfortable for the patient. Trying not to expose the patient as well. This is the dirty, soiled gown. I'm going to take that away. All right, so we would start with the far arm first. I would take a new towel. Place it underneath the patient's arm. And then I would take the water basin, and I would apply soap into it. Soap is in. Place the patient's hand into the basin there while I do his arm. Once again, doing a mitt. Okay. So I would start from the top down. patient's arm and hand. Okay, and then after drying, move this out of the way. And after this, I would go ahead and apply lotion to the patient if they were to need it, and deodorant to that side. Okay. Then I would cover the patient's arm back up and work on the side of the patient now. Again, soaps in the water. That's for cleansing the body. Go ahead and make a mitt. Washing the patient's hands. And drying the patient thoroughly. Removing the towel. And applying lotion and deodorant to this arm as needed. Okay. And then from here I take this down, and since we have privacy, it's okay to do this. Use a towel, this part of the patient's chest. With soap, and go ahead and start washing the patient's body. Okay, and then go ahead and pat everything dry. The blanket. Okay, from here I would go ahead and exchange the water and get fresh towels after doing the face and the upper part of the body. Now, I would go ahead and start doing the lower limbs, putting the towel underneath the leg. Using soap again in my water. Mix together. Cleaning from ankle to knee and then knee to thigh on the patient. Making sure I don't go near to any wounds or bandages that need to stay dry. Okay. And then I would pat the patient's leg dry and the foot. Remove the towel. And then from here, move to the other side of the patient to the other leg. Okay. Taking a towel, putting it underneath the patient's leg. Great, using our soap and water again to wash from ankle to knee and from knee to upper thigh. And foot as well. Great. Now, since we're done that, we're gonna go ahead and change the water again. New towels, 2/3 more of soap and water. And I'm gonna start at the back of the patient. Okay. So I'm gonna have the patient roll to his side. Repositioning the hips. Comes down his side. Trying to cover the patient back up with the bed blanket here. While I'm doing the back side. In here, I'd be looking for any skin redness. You know, anything, any ulcers or anything that's starting to develop. So I would check the skin thoroughly as I'm doing this whole procedure. It looks like there's a little redness here on the back. So I would document that after. So new clean soap and water. And I would go ahead and start this. Taking the towel, putting it as close as I can to the patient. Making a mitt again.
It's okay, you can say it.
Soap and water in here.
I know.
I didn't forget anything else.
And then going ahead and cleansing from the top of the neck down the back.
I'll try to, I mean, just like, like, if you don't, if I forget something, I'll let you know.
Trying not to touch the reddened area at all.
You practice one.
Okay. And then from here, I would pat the patient dry. And then if the patient needed it, I would grab some lotion and I would go ahead and apply it to the patient's back and also give, you know, a nice back rub for a bit. Okay. And then from here, I would change my linens once again because we're going to go ahead and do the bottom, the patient's bottom. So I would change the water and the linens.
How's it going?
Okay. And so from here, I would take a new clean towel, try to place it as much as I can under the patient's bottom here. Okay. And with some water here, clean the patient from front to back. Okay.
That's why you put it underneath the butter.
Okay. And then cleaning this up, patting the patient dry, because we don't want any moisture down there. And then from here, we would go ahead and bring the patient back down. Slowly and comfortably. Try not to expose the patient. Okay, and then I would establish a new gown, a new clean gown for the patient. Take the back blanket off.
So I'm gonna put this on.
The soiled linens on there.
Well, no, I used this. Oh, that's on top. This one? Yeah. I just took that off. Ready? Just back off. Alright, yeah. Put that. That. This one like this. Well, let's do it.
Tie that up. And then from here, I would use a new sheet, new clean sheet for the patient.
Yeah, not really bad. Yeah.
Because he's all clean. Looks good. I would ask if if he's doing okay, if he needs anything else. I would establish a call bell here for the patient, and I put the side rail up. Bed is going to go all the way down. Alright, and I would move everything out of the room here. Dispose of the soiled linens. I'm going to clean that up, and I would remove my gloves and wash up, and that's my video. Thanks.